It is now 10:03 a.m., and we can begin our webinar. Our topic for this month is Medi-Cal Connect. Next slide. I would like to introduce myself. My name is Felicia Oropeza, a Research Data Specialist 2 for the Managed Care Data Support section, and I am the webinar moderator for the current month's webinar. Next slide. The speakers today will be Amy Peterson and Dr. Laura Miller. The following staff members provide support for the webinar: Alvin Bautista, Abi Gebrselassie, May Shanyan, and Cheyenne Ma, and myself, Felicia Oropeza. Next slide. For general questions, please submit your question to the WebEx chat, and please ensure that your questions are visible to all participants because I'm not monitoring the chat. Once again, if you have any questions from the webinar, please go ahead and unmute yourself and put your comments and questions in the chat. For specific questions, please reach out to the appropriate data mailbox, as will be instructed closer to the end of this presentation. Next slide. Before we move on, today's webinar is being recorded for documentation purposes. The recorded video, script, and presentation materials will be uploaded to Data Reporting and Monitoring webinar series. The glossary and FAQs are also updated regularly every month. Next slide. As a reminder, please turn off your microphone now if you're not presenting. Thank you all, and now I'd like to introduce Amy Peterson, Chief of the Managed Care Data Support section, who will speak on webinar topics.
Thanks, Felicia. Next slide, please. I just wanted a quick slide so that I could ask folks who are participating today live a little bit about themselves. We don't have a lot of audience information, and so we're kind of looking for what your role is in your organization, and then what kinds of topics you're looking for DHCS to present, data-related topics that you're looking for DHCS to present. What would be most valuable to you or your team, and going forward, that way we can reach out to the different groups at DHCS who would be good presenters for your topics. And to get a little bit of audience information, we're looking to see what your role is. You can put that information in the chat, and then we can get through this real quick because I want to introduce you to Dr. Laura Miller, and she is going to be presenting on Medi-Cal Connect. Thank you very much. Next slide.
Wonderful. Whoops.
Sorry.
Okay, thank you, Amy, and wonderful. Good morning, everybody. It's a pleasure to be here. This is a cast of thousands, 241 people, so I'm really glad you're here. We are absolutely trying to get the word out about Medi-Cal Connect. My name is Laura Miller. I'm a primary care internal medicine physician. I've been at DHCS since August of 22, and I'm in the Quality and Population Health Management Division. You may know us through the work we do for ECM, Enhanced Care Management, but also a big project, audacious project within Quality and Population Health Management, and really for the whole department, is Medi-Cal Connect. Its former name was the Population Health Management Service. It's been in the works for quite a while, and it is coming live to health plans July 18th. And that's really why we wanted to get in front of the tech reps, really the data people with plans, so that you know what's coming and you have an opportunity to ask questions. So with that, I will dive in. So we're going to do an overview of Medi-Cal Connect. We'll tell you what we've done with our advisor plans. The advisors are a small and mighty group of health plans who are diving in with us in the lead up to our release to really test drive important pieces of Medi-Cal Connect. We'll talk a lot about the data sources for release 3. We'll talk about what we will be putting out, data that we will be sending to you via API. We'll talk about the dashboards that will be available in the Medi-Cal Connect portal, and also the longitudinal member record. So this is a lot to take in. You will have the deck, and if we have time, I'd love questions in the chat. I will try to get to them, but hopefully the deck itself will answer lots of questions. So next slide, please. So the vision of Medi-Cal Connect. I've been speaking this vision for several years, and it really is an important and audacious vision. The idea behind Medi-Cal Connect is to provide a data-driven business solution that supports whole person care by integrating information from trusted partners to support pop health functions and allow for multi-party data access and sharing. When I look at this as a primary care physician, which is really my heart and soul, the key words here are whole person care. We know that our Medi-Cal members are more than just their physical health or their behavioral health. They live in an ecosystem. They live in a social structure that absolutely affects their health. So when we have information that reflects all of those different elements of a person's life, we can better serve them. And it really is all about service and improving health. Many of the time I as a doc would just see physical information and couldn't get a behavioral health med list. That is, Medi-Cal Connect is really trying to turn that on its head and make information from multiple disparate sectors available to those caring for a member. Next slide. So I'm going to go through some key features of Medi-Cal Connect. The first one to talk about today is the longitudinal member record, the LMR, as we lovingly call it. It is a member by member look at a person's records. So it includes their diagnoses, their providers, including providers like complex care managers and ECM care managers. And we think it's going to be an amazing tool for care managers at the plan. There is a quality dashboard. We think that'll be helpful for folks doing quality analysis within the plan. And it really is a rolled up view looking at data analytics regards quality measures. And then the last box here is the risk stratification, segmentation, and tiering work. So we lovingly call this the RSST. The RSST is an algorithm that has been developed to standardize risk stratification across the state and identify members who may benefit from services. It includes both behavioral health information, physical health information, and social information. So unlike other algorithms that are looking for, increased spend, this is really trying to look at the whole person and predict a risk of adverse outcomes in the coming year. We think this will be highly useful for care managers. There is a lot of work that's been done on the RSST. I'm not the SME, I'm not the subject matter expert for it, but it has been a very deep piece of work informed by both a scientific advisory committee as well as a group of academic researchers. Next slide. So we will aggregate health and social information from many sources to support members and communities. I think I've spoken to that piece. Next slide. So I like this graphic. It really says many of the things that I've said before, but on the one side, you see housing agencies, Medi-Cal plans, public health, Department of Social Services. This is where the data is coming from. We pop it into Medi-Cal Connect, and there are multiple outputs, including the stakeholder portal as well as care management features, the LMR or longitudinal member record, dashboards, and also a knowledge center. That's really the learning management center where folks can receive their training and self-serve on modules that will help them understand how to navigate Medi-Cal Connect. And then ultimately, the outputs are data that supports member care and also data that helps all of us improve our policy and our programs for communities. Next slide. So timeline. I will note the big yellow star here. Release 3 is coming to Medi-Cal plans on July 18th. We've had 2 releases prior. They have been within DHCS for a small group and then a larger group of DHCS employees, essentially to test drive the service before it's deployed externally. We have a big yellow "We Are Here" arrow. This is the advisor engagement that I'll talk about a little bit later. Down below, you'll see MCP onboarding for admins and tech reps. More to come on this, but we are going to be leaning on the plans to send us names of folks who are administrators and technical representatives. The administrators will do a lot of the onboarding. They will get people in your plan signed up for the service. And the tech reps are, in some ways, are troubleshooters. People who are well-versed in a plan's technical milieu and can communicate challenges and with us. We will begin onboarding office hours in advance of release 3, and then ongoing, we'll have training for plans. We want to have training be very close to the release of the service. It does not make sense to train for a new service months in advance. People forget. And Q4 25 and beyond, there are plans very well in train to keep adding capabilities and data to Medi-Cal Connect. It is not a one and done. It is an iterative process, and it will keep growing. Next slide. So the rollout approach. I talked a bit about this. I'm going to dive into advisors now. In terms of our engagement with plans, in the latter part of 2024, we talked with multiple plans that we call early adopters. Conversations about their systems, their needs, their challenges. Then in Q1 of this year, we dove in with advisors, a small group of plans to really test drive and engage with us on multiple aspects of the service. And then starting Q2, we're engaging all plans, hence my crashing this forum so that I can explain to you about Medi-Cal Connect and begin to make sure that you are aware of what's coming down the pike. And then, of course, R3 launches July 18th, 2025. Next slide. So I mentioned a lot of this. With the early adopters, we talked about use cases and value propositions. With our advisors, we really have validated the service. And it was a significant commitment of resources when we put out the email saying it could be 8 to 10 hours a week from your teams. We didn't have a lot of people rushing forward, but the plans that have engaged with us have been really stalwart and amazing. And then starting May, this month, we're engaging with all plans in a multitude of different forums. Next slide. So this is essentially a little bit of a drill down on the curriculum, if you will, or the priorities that we've worked on with our advisors. They've dived into the risk stratification, segmentation, and tiering algorithm. There's been a lot of talk about the RSST, and in fact, the plans are essentially taking a sample file of their members and comparing and contrasting. So they've received 100 high tier and 100 low tier members that the DHCS algorithm defined and identified. and then comparing and contrasting with how those members are risk stratified in their own plan. This exercise is ongoing right now. We don't have answers, but I think it's going to be a very, very interesting conversation. Are we concordant? Are we discordant? What's that about? So very interesting there. We've had discussions on access and permissions. Who's getting access to what and how is this governed? We've gone into care management, which is a lot about the longitudinal member record. There's been a lot of enthusiasm for the LMR in the way that it pulls together data from multiple sources and things that not everybody had access to see. So I think that's a really important piece. And then APIs and data sharing, the pipes. How is this data going to get to plans? How are plans going to ingest it? And what does all that look like? Next slide. So these are our stalwart plans, and I will name them and give them all a shout out. So we've had beautiful participation from HealthNet, Health Plan of San Mateo, IEHP, Kaiser, and LA Care. So big shout out to those physical health plans. And also we've had representation from behavioral health. Cal Mesa has been in our work groups, as well as Orange County Behavioral Health. Medi-Cal Connect is not going live for behavioral health plans until later on in 2025, but these two organizations, Cal Mesa and Orange, were engaged and ready, willing, and able to be in the mix with us. So that is deeply appreciated. We will have a similar advisor process for behavioral health plans as we get closer to their release, which at this point is slated for November of 25. I won't read it out, but we've had all sorts of people in our meetings. They've been quite well attended and really pulled from across the managed care plan internal resources. Next slide. So I talked a little bit about the curriculum. I'll dive in a little deeper. So RSST, they are doing that comparison, looking at output as of January of 23, and then looking at those people and what did they receive from the plan. In terms of care management, the plans have been reviewing components of the longitudinal member record. For API and data sharing, they've been looking at API capabilities to understand expectations for connectivity, security, and consumption. And then access and permissions, we've been reviewing workflows and associated responsibilities for administrators. Next slide. So we've had 8 working sessions to date, including a kickoff meeting, a show and tell, and then 5 sessions focused around the capabilities. Advisors have been super engaged. It's been really, really positive. We've had 30 to 40 plan staff. We've captured over 125 questions that we are answering. And really wonderfully, the advisors are saying, wait, we want to talk to you about more. Let us at the tech specs. We need to opine about policy considerations. We want to see the onboarding guides. So it's been really fantastic. And hopefully their engagement will improve the experience for all other plans. And I think that's absolutely going to happen because we've made shifts and adjustments based on advisor input. Next slide. So data sources, let's move here because I'm sure this is of interest to this group in particular. So they're listed here are data sources that will be available in Medi-Cal Connect as of release 3. And I think you probably know these data sources better than I, but Medi-Cal Connect uses the APCD, CDL file, the all Medi-Cal claims data file. So it has medical, dental, pharmacy, providers, service dates and procedures and diagnostic codes. There's also the supplemental eligibility file. This contains member demographics, contact information, and some data for specific programs. Next slide. In addition, we have data that Medi-Cal Connect itself is generating. So this is new information. We've worked hard to build a business logic for member flags. So you will see when you have access to the service, there are filters for likely, possibly eligible for ECM, homeless population of focus. It does not mean that they are rock solid eligible. It means get curious. We see evidence in the information that we have that they might qualify for that population of focus. The risk tier output from RSST will also be in the data. Folks will be categorized as high, medium, and low. There'll also be evidence of underutilization. The JSON file is used in Medi-Cal Connect. So you'll be able to see ECM and CS member enrollment details, ECM provider information, etc. This is not new data for our physical health plans, but it is new data for behavioral health plans when they get access. And I think this kind of amalgamating the data and breaking down those silos can be incredibly important. Next slide. There's also included will be the primary care provider assignment file, giving members assigned PCP, etc., and also the 274, the provider and organization data. And that, again, as you can see, will give all of these key data points that are in the 274. So provider information, organization details, office hours, telehealth, languages, etc., etc. Next slide. I clearly need more coffee. There will also be CalFresh information. Members who are enrolled in CalFresh, including their enrollment status and their related data. In addition, there is IHSS information about folks receiving IHSS in-home supportive services, and including their assessments, their claims, and their providers. As well, there will be information about WIC. This is comprehensive information on members enrolled in WIC. Caveat here, the WIC information is used only in the RSST algorithm. So it's an input into RSST. We don't yet have permission to share the deep details on WIC. Hopefully that is coming, but we are able to use it within the RSST to refine those risks. Next slide. So API. Medi-Cal Connect will have 2 external-facing APIs that enable DHCS to share member data in a standardized and secure manner. These APIs include the monthly risk tier, and that is the information about the output of the RSST algorithm. So this is giving the ability for plans to retrieve the monthly all-member RSST tiering data. Same thing with the longitudinal member record, or LMR. The API will give the ability to retrieve the LMR for assigned members. Next slide. So this is an overview. I really went over a lot of this. This slide is here in part because it's really nice to have sometimes more language than less. So I've voiced over these pieces. So I think we can just go on to the next slide, but it is here for your reference. Next slide here, we're talking about the data sources for the API. So you can see the data category, the source file, the description, and then which API the data will appear in. So member demographics are in the risk API, as well as in the risk tiering. Just those 2 elements in the risk API And then the LMR API contains all of the different data elements. Again, a good slide for reference, absolutely not you don't need me to read it to you. So next up, I'm going to talk about the API data flow and architecture. Caveat here, I am a primary care physician. This is not my area of expertise, but I'm going to try to walk you through this slide. So the external APIs are built on a FHIR version 4 standard and offer both member level and bulk retrieval mechanisms. So in step 1, the MCPs make an API request, and the MCPs are here as stakeholders. They make a request to the DHCS API gateway, and that request arrives. Then that request is routed over to Medi-Cal Connect, this PHM AWS over here. Then that's InterSystems over there. And the InterSystems API gateway responds to that request, and then data is routed back through the DHCS API gateway and back to the plans. So essentially it's a loop. Plans ask DHCS, DHCS pings InterSystems, the API gateway, and then it comes back out to plans. Next slide. So I'm going to talk quickly about the monthly risk tier. And again, this information is pertinent to MCPs only. The RSST by policy is going to be, use of the RSST is required for plans, for physical health plans, not for behavioral health plans. Next slide. So the API will provide bulk access to risk tier data for members. It is available to MCPs only. It returns member contact information and tiering information for all members, and it will be based on the most current eligibility file processed in Medi-Cal Connect. So that's the piece there. Again, a lot of the access is based on the most current eligibility file. It's a very concrete linkage piece, the eligibility file. Next slide. The LMR. We'll talk about the LMR and its life in the API. Next slide. So we really like this slide, the honeycomb slide. It's a bit of a graphic on the LMR. It enables plans to access a comprehensive profile of members affiliated with their org to support care coordination. So the blue hexagons here are all the things that are currently in the LMR, the longitudinal member record. Quality measures, risk tiers, care providers, etc. The white hexagons are things that are coming. Immunization records would be awesome. That's in the plan, but it's not, we don't have permission for that data yet. And just a caveat, I said this, WIC enrollment will not be used in Medi-Cal Connect for release 3. So we're getting there. There's so much work done on access and permissions, actually on getting permission to use data. So it's been a long haul, but we're making progress. Next slide. Dashboards. Via the portal, plans will be able to see dashboards. So I'm going to talk about dashboards that are available to DHCS users as of release 2. We have multiple. And then the quality measure dashboard will be available to plans in release 3. We're working with the advisors on mock-ups to share with the advisors on these dashboards. We're really hoping to get the rest of the dashboards out to plans, but that's a TBD right now. So again, these two are available to DHCS internally. The condition prevalence dashboard This helps us explore utilization metrics for subpopulations related to selected comparison groups. So that is really helpful internally for our analytics and policy development. We also have the quality measure dashboard, and this is the one that will be available to physical health plans. And it's the ability to analyze quality performance in a given calendar year. And there is a drill down to member level data. Given that one of the examples I like to use in the quality measure dashboard is, let's look at colon cancer screening for people who are enrolled in ECM and not enrolled in ECM. Just compare and contrast, and you can find some really interesting insight to help drive program and policy. Next slide. These are the other dashboards that are available within DHCS. There's the health equity dashboard. It enables us to monitor existing knowledge about disparities, looking at various measures by race and ethnicity. The RSST dashboard, again, an internal DHCS dashboard allowing us to track the distribution of risk tiers across the Medi-Cal program, including being able to look at statewide averages, regional averages, et cetera. And then the care management demographics. This is a drill down into the demographic data on members receiving ECM and CS. So these are dashboards that we have available internally, and we're working on getting the health equity and the condition prevalence out to plans as well, but there is no clear date on that yet. Next slide. This is a brief view of the quality measure dashboard. It is a mock-up just to give you a sense of the look and feel of the dashboards. And we do have heat maps. Folks are very, very interested in within DHCS. There's been a lot of excitement about the heat maps. And then one can look at various different quality measures and then see the performance across time. Next slide. I'm going to show you some screenshots of the LMR. Next slide. So the LMR has many, many features that we think will be incredibly helpful for care managers. There's a summary of the member view of the member's health history, contact information, diagnoses, care team information, claims, their risk profile, and programs and services, eligibility and enrollment especially. And this is where I think you get a really clear and fun picture of how this aggregation of data across systems can be really, really beneficial. Next slide. So this is a mock-up. Nia Johnson is not a real human. Okay, so this is a mock-up and it is small, but I want to give you a flavor for what you can see here. So I talked about that RSST. So this is like the landing page for Nia. And the first thing that you see is she is high risk. So she has been identified in the risk segmentation, risk stratification segmentation and tiering algorithm as high risk. So she's got rising risk of adverse physical and behavioral health events. She's got rising risk of underutilization, and she is at high social risk. So this in and of itself can give the care manager clues as to what is going on. You can see in the next bar her health status. She has 5 chronic conditions. She's eligible for some programs, we think. She's on 6 meds and at least 1 unmet measure. She's already enrolled in ECM and community support, and you can see her primary care provider and some of her utilization. I think one of the things about this view that I like as a primary care provider is that it is very clean. It is visually impactful and gives you information that you need right off the bat. Next slide. So this is a little bit of a dive down into the risk profile. You can see how it might change over time on a month-by-month basis. And there are also keys to look at the past 6 months, 12 months, and 24 months. Next slide. These are programs and services that she is enrolled in or eligible for. So she actually is already enrolled in ECM and community supports. She is authorized. She's enrolled in ECM and authorized for community support. Community supports. You can tell this is a mock-up because it says Partnership Health Plan in San Diego, and she's getting services in 211 by 211 in San Diego. So that is a mismatch. It's a clue to tell you that we are not sharing any PHI here. But again, it gives you a sense of what's going on in terms of program eligibility. Next slide. Okay, I have gone relatively quickly. We thought I couldn't get through. Next slide, please. We'll talk about next steps. So we are working really hard to get ourselves in front of any and everybody from plans to let you know what's coming down the pike. We've snagged space at the CalAIM MCP TA calls, which is on the fourth Thursday of the month. We are definitely at the Plan Association calls. This is a Friday morning meeting that occurs every week with DHCS, Local Health Plans of California, and California Association of Health Plans. We're certainly there monthly, and we can get on that agenda relatively easily for updates. We're going to be speaking at the CEO meeting as well as the upcoming CMO and Chief Health Equity Officer meeting. And then we're here today at your data reporting and monitoring webinar. So wondering if, and you could put these in the chat, if there are other venues we could and should consider. So if you could put those in the chat, that would be awesome. Again, we're really trying to get the word out. We're going live July 18th and want to make sure that all folks are aware of what's going on, have opportunity to ask questions, and understand how how Medi-Cal Connect can benefit them, their plan, and the members that they serve. Next slide. Comments and questions. So I'm going to hop into the chat really quickly. Okay. Alicia Martin, will the quality measure dashboard include all of the BHAS metrics? I don't know if all, but it will include many. There is a crosswalk on that, and I don't have it in my head right now, but we can get that back to you. I know I have lovely people on the call, including Alexis Sabor from Gainwell Technologies. The Gainwell team has been quite amazing, and we can gather these comments and get back. Okay, Christine says, congratulations on your progress. Thank you. We appreciate it. I will take that back to the team. Will the dashboard support the recently released CATS measures that is meant to standardize HEDIS-like measures for the programs throughout DHCS? I believe the answer is yes, and the exact date that it will support all of those is not entirely set yet. There are plans for the measures in Behavioral Health Connect and Behavioral Health Transformation to be reported out through the service sometime next year. So more to come on that. From Norm, will MCP delegated entities be allowed to access the dashboards? I wish. We are At this point, because of all of the issues around access and permissions and figuring out which plan has access to, appropriate access to members, we are not going to be delegating access. So access goes to the prime plan and not to delegates. Hopefully, this we'll be able to figure this out down the pike. But we worked super hard to try to figure it out, and we spent a lot of time very recently, like delving into all of the pieces. But right now, it is available only to those prime plans that have a contractual relationship with DHCS. Please present at the Regional Quality Collaborative. Okay, thank you, Christine. I think I need to know more. Or just help me if there's somebody within DHCS who convenes those. I just don't have enough context on that, Christine. Thank you. When will this be required for specialty mental health? So to break it down, behavioral health plans are set for release 4, which should be happening in the fall of this year. There is no specific requirement for behavioral health plans when you get access to Medi-Cal Connect. The physical health plans do have a policy requirement to outreach to high-tier members outreach to high-tier members, period. There is policy refinement being done. And for physical health plans, the requirement to do something does not go live July 18th. There will be a ramp-up period. So this has been a huge issue of commentary and debate and back and forth between the advisor plans and DHCS. It's been a really, really great conversation, and there will be a ramp-up period, so please do not panic. But in terms of access for specialty mental health, it should be in the fall. And again, no requirement to use it. It is, but we think it will be incredibly helpful. Let's see, expected timeline to receive API connection instructions. So great question. I think I mentioned that in a slide. Alexis Saber, if you can come off mute, you can save me. And
Laura.
Yay, go Alexis.
So there is no expectation necessarily for APIs to be implemented prior to July 18th, which is when the launch of Medi-Cal Connect happens for our managed care plan friends. However, there will be opportunities through the onboarding process that Laura had noted in her presentation for the technical representatives to learn more about what configuration looks like and take steps to start that process prior to July 18th. But much like Laura already noted, the only requirements for MCPs fall under RSST. So implementing the API is dependent on your organization and what you're able to do.
Great. Thank you, Alexis. I knew you could save me. There's a question. Well, one, the updates sound really exciting. Thank you. Will any updates be made to the current MCP monitoring dashboard? No. Medi-Cal Connect, not yet. And perhaps Amy can speak more to that, but our public-facing dashboards are not changing because of Medi-Cal Connect. So that's the short answer there. And Bert Sloan asked, what are the plans for behavioral health plans use of access to Medi-Cal Connect? So we will be having an advisor process, much like we have had for physical health plans, with a huge shout out to Orange and Cal Mesa for coming in early and playing with us. There will be an advisor process, there will be an onboarding process, and all of that. We are expecting that release 4 will go live to behavioral health plans in the fall. There is no mandate about how one must use it, but certainly it will be available for exploration. And then I think the really cool thing is for behavioral health plans that the decision was made to have the BHT and BH Connect measures calculated in Medi-Cal Connect. So that I think is exciting. And then when that happens, it will be incredibly useful. So I think exploring it and understanding it before those measures are in might be really, really helpful. And I think for within behavioral health plans for care managers, the LMR could be absolutely stunning. So more to come, but certainly getting your awareness of all of this right now is really helpful. Can you clarify if there would be APIs to consume the 834 eligibility enrollment data via Medi-Cal Connect? Those will be separate. You will be getting Medi-Cal Connect data. There's that one slide on the data that goes into the risk tiers. The data that goes into the APIs. So I think that answers the question. If not, somebody might be able to save me, but the API is going to be used for data related specifically to Medi-Cal Connect. Will the required quality measures for BHPs be NCQA certified? That is a question where I am not the subject matter expert. I know that Dr. Jeff Norris is doing a lot of the leadership on that piece. And in terms of the relationship between NCQA and those quality measures, I cannot opine. That is a question for Jeff and the team working on that. What ID is used to determine correct patient in API request? The plan one, oh, go ahead, Ms. Alexis. Thank you.
No problem. Hello. So as part of the API onboarding process, each user group is going to receive a special secret.
I just lost audio.
We lost Alexis. It sounds like an encrypted.
Oh, no.
ID.
Yeah. Yes. Alexis, we lost your audio. It will be encrypted. There was a lot of really good information on the API call, which as a non-tech person, I cannot repeat it, but there were tokens and handshakes and all the right things.
Exactly.
Alexis, you're back. Oops.
I'm so
Try again, darling. You totally cut out. Yeah, you had just started and then you went away, and I tried to fake it.
You're talking about the encrypted
the tokens,
ID,
the handshakes.
That is exactly right. There will be. Can you hear me now? Okay, perfect.
Yes, we can.
It's going in and out, Alexis.
You know what? Perhaps what we can do is Alexis can put it in the chat or yes, of course she will respond in chat. That's great. Thank you. And then the other question, this wonderful tool allows users to correlate best preventive practices with certain member behavior. Is that right? Absolutely. I mean, I think that's the really cool thing is that we will be able to ask questions, slice, dice, filter, try to understand associations, and then move forward with programs. And, on one of the slides, I talked about DHCS policy initiatives and program improvement, but absolutely for plans. I think it is really a tool about getting curious about the associations that is seen. So yes, it is DHCS internal, but absolutely it is a tool that can be used to try to do those correlations for your plan. Absolutely. We're really, really thinking this is going to move us down the road. Are there scheduled dates for the MCP onboarding? Not as of yet. You know, there was a timeline slide in there that does have sort of ranges, but we have not yet solidified dates for that. There'll be giant Zoom meetings, and we'll get you that information as soon as we can. We're doing a lot of the planning now, and we do realize that we want to have all of our trainings and onboarding relatively close on to the go live date. And again, I'll note this is not a claims system, right? So the onboarding can happen in a relatively relaxed fashion, if you will. There's nothing that must be done on July 18th. And we will let you know for sure. That's where your admins and your tech reps from your plans are going to be really important as well. We're putting out a communication to all the CMOs and CEOs with sort of an official launch welcome to Medi-Cal Connect email. I'm hoping that goes out this week. And then that gives us the go ahead to reach out to all plans, all physical health plans, and ask for your admins and your tech reps. And those will be sort of our major points of contact. Alexis, I don't know if you are furiously typing in the chat. I do notice that we're at the 55 mark. I'm certainly happy to answer more questions. Where was the resources slide? Can you flip?
Thank you.
Yeah.
Thank you, Dr. Miller, for your presentation. We will post any other general questions in the FAQ, and we
Okay.
will send out a notification when the questions are answered. DHCS will also send answers directly to people who email mcdss@dhcs.ca.gov. And we can get the information directly to QPHM and you, Dr. Laura.
Oh, yeah. I'll be
Next
glad
slide.
to do that. Just before everybody flies away, Alexis did toss it into the chat. So plans will get secret tokens from DHCS that identify the MCP org. Once the MCP is confirmed, you'll be able to access data based on your attributed members. Okay, and that will be covered in onboarding. And I love this question about the vision for Medi-Cal Connect and the DXF. They are intimately related, very much so. In a lot of ways, the DXF is sort of the roadmap for all of the data exchange. And as the DXF moves forward and becomes more of a reality, the data exchange that enriches Medi-Cal Connect will be enabled. So they do go hand in hand. They're sisters. All righty. Well, again, thank you so much for your participation. I love that there were so many folks on this call, and I really hope this has advanced your understanding of what Medi-Cal Connect is, what our vision is, and how it can support you in your work. So thank you very much. Much appreciated. And thank you to Amy and her team for supporting me and coming to you all. Very exciting to talk to some 241 people.
Thank you very much for your time, Dr. Miller. And just to summarize, there's some resources that are some live links to resources on the web for behavioral health managed care. Next slide. Dental health, dental managed care, and PACE. Next slide. HIP programs for all-inclusive care for the elderly. And next slide. Medical managed care programs. And those are the current mailboxes for the different topics. And technical support also. Those are the mailboxes. So thank you, everyone. for coming, for attending the webinar, and to give you a preview for next month's webinar in June, the topic covered will be the Encounter Data Quality Improvement Efforts Part 3. The date of the June webinar will be June 25th, 2025, from 10 a.m. to 11 a.m. Next slide.
Thank you so much. All of these links will be live. Thank you so much, Dr. Laura and Felicia. You did a great job. Thanks for all the questions, and we'll be getting those out to you very soon. Take care, everyone. Next month.
Thank you. Bye-bye.
Thank you. Bye.